Hey everyone, welcome back. Today we're tackling a major issue that's been popping up more and more, and that is electronic health records, or EHRs, and why they're so challenging for the elderly. This digital systems were supposed to make things easier, right? My parents have the same issues, but for many adults like my parents, they've actually created a whole new set of problems. Let's talk about why that is and what we can do to help our elderly loved ones navigate through this digital healthcare world. Let's begin. Electronic health records are basically digital versions of your medical history. Lab results, prescriptions, doctor's notes, nurse's notes, all in one place. For some people, very useful. But for elderly patients who may not be familiar with technology, accessing and understanding this information can feel overwhelming. Here's the thing, though. Most elderly people didn't grow up with computers and smartphones like we did. And for them, learning to navigate an online health portal, entering passwords, clicking through menus, and finding specific test results, it's really not going to be second nature, right? Like for many of us, because we grew up using smartphones. Their generation really didn't grow up with the amount of technology that we have grown up with the internet and being able to get our health information just at our fingertips. That was not available. In fact, it was difficult to even get a printout of your lab values. You had to make an appointment with your doctors to even go over that. Now, we have technology that provides information, healthcare information for the patient, but that information cannot help if it doesn't get to the patient. And for some, just getting through the login process is a challenge. We call this the digital divide, and it's real. Heck, I even have trouble remembering all the dozens of passwords I have. Think about it. Strong passwords, security questions, multiple step authentication. What feels like a basic stuff to some of us can be really frustrating for older adults who didn't grow up using this kind of technology. That goes for my parents, and I see their frustration when they're trying to figure things out that's related to technology. Now, why does this all matter? Because testing or missing a test result or a prescription refill isn't just about inconvenience. It can seriously affect your health and your parents' health. I've heard stories of elderly patients missing critical follow-ups. And my parents also miss appointments because they didn't look at the reminders and forgetting to schedule appointments because they couldn't access their portal. So they just kind of gave up. To be honest, a lot of elderly patients prefer a phone call over a letter or an email that they may never open. My parents get both from their insurance company through their electronic health record and through regular mail. And let's be honest, a lot of older people would prefer a phone call or letter over an email that they may never open or don't even know how to open. And then there's that emotional side of it. It's easy to forget how frustrating and isolating this can feel. I mean, think about the first time you tried using a different device. And that's kind of the feeling that older people who are not used to these technologies are going to feel, the frustration and not being able to ask for help. Imagine being confused by something so important and feeling embarrassed to ask for help because you may not even know what to ask. And many seniors feel like they've been left behind, which can affect their confidence in managing their own health care. And that's kind of the example with my parents, particularly my dad, as he has developed early signs of dementia, which makes it very difficult for him to follow through with his healthcare. So what we can do to help them is first be patient. If you have a parent or a grandparent, sit down with them and help them navigate through their EHR. Walk them through the process step by step and don't assume they know how to do everything just because it seems simple. For my parents, I ended up not showing them, but actually logging on to their health system. So I have all that information and I just share that with them. And if you can, simplify where it's possible. Some systems allow you to customize the interface or set up alerts for things like prescriptions or appointments. If the system allows it, set up automatic reminders that can go to their phone as a text message. There are also community resources out there, many libraries, senior centers, and even some healthcare providers offer tech training and support because they know it's necessary that population gets the information that they need. If you're not able to help in person, these programs can make a huge difference in bridging that digital divide. And finally, it's important for healthcare providers to recognize this challenge. We don't do enough for the elderly population. Offering more tech support or even bringing back some low-tech options, like mailing important information, can go a long way in making sure that seniors don't miss out on crucial healthcare information that they may need sooner than later. So while electronic health records are here to stay, it's important to acknowledge that not everyone finds them easy to use, especially the elderly. If you have a loved one struggling with this, take the time to help them out. And if you're someone working in healthcare, think about how you can make these systems more accessible. Now, as a nurse, I always kind of wonder what my older patients, when they're discharged, how they're going to retrieve this information. Let me know in the comments section if you had to help someone navigate an EHR, or if you run into issues yourself. And don't forget to like or subscribe and share this video with anyone who might find it useful. And thanks for watching, and I'll see you next time.